Hi, my name is Sukhpreet Kaur. I'm a student of Master of Health Science in Services Management. My student ID is 221221 and 68. Today I'm going to give a presentation on a change management. The topic is strategic change plan to address poor workplace culture in an urban hospitals. So what is change management? It states the structured approach to transition organizations to a desired future state, enhances staff engagement, leadership, and patient outcomes. It applies evidence based frameworks to change in 2010. Your role and case study context. Role: Health Service Manager, HR Leadership Perspective, Case 500 bed urban hospital in NSW. Context: Poor workplace culture with disengagement and mistrust. The problem, hand, it states in three categories. First is staff survey, low scores in communication, framework, and grievance handling. Second is leadership issues, favoritism, poor acknowledgement, and selective communication. The result is low moral, mistrust, burnout in 2010, and Hofstede in 2001. Next slide is about organization and presentation structure. First is urban multicultural 500 bed hospital. Next is key focus areas. It divides in a four. First is defects in culture. Second is evidence based strategies. Third is key stakeholder communication and timeline. Fourth is conclusion and takeaways. Next slide is about the defects in organizational culture. First is leadership favoritism, low trust, weak communication and grievance handling. Result is disengagement and burnout and mistrust. Next is evidence based strategies. Inclusive leadership and bias training, Cotter in 1996, Armanax in 1999. Stronger communication and grievance system, Sachin in 2010. Expected outcomes. First is improved moral and staff engagement. Next is restored trust in leadership. Third is stronger collaboration equals to better patient outcomes. Next is resource management. First point is budget allocation for leadership, training, and staff engagement. HR resources to design and deliver programs, protected staff time for training and peer support, external consultancy support where required, sustainable funding through hospital budget reallocation, feasibility introduction. Approach to feasibility. First is stakeholder plan, communication strategy, implementation timelines. Second is aligns with available sources and evidence. Next slide is about stakeholder plan. Stakeholder plan divided into four categories. First is general manager, HR director, and clinical staff, and the change champions. First stakeholder plan is general manager. It acts like a leadership accountability and contributes to the approves and models of the behavior. Second is HR director. The role of HR director is in HR systems and policies. It contributes to the overseas grievance and feedback. Third is clinical staff. The role of clinical staff is frontline input and it contributes to the feedback loops and participation. And the last stakeholder plan is change champions. The role of change champions is peer influence. It contributes to the support adoption of change. Next is communication strategy. Uh, there are four methods: staff meetings, anonymous surveys, HR grievance channel, internal newsletters. The first method is staff meetings. Frequency is monthly and the purpose for the updates and feedback. Second is anonymous surveys. The frequency is quarterly and the purpose is monitor morale. And the third is HR grievance channel. The frequency is ongoing and the purpose for the safe reporting. And the last fourth one is internal newsletters. The frequency is bi-monthly and they are the purpose for the transparency. And these are the communication strategies. And my next slide is shows the graph for the timeline of change management plan. The timeline of change management plan is from starting to January to the end of the December. Next slide is the evaluation process. First is staff satisfaction and engagement surveys, baseline and post implementation, monitoring staff turnover and absenteeism rates satisfaction and safety indicators, feedback forums, and the continuous improvement, quarterly progress reports to the hospital leadership. The conclusion is restated issue, strategy, and the takeaway. First is restated issue. It states for the poor workplace culture. The second is strategy. Strategy is inclusive leadership plus communication reform. And the third is takeaway. Takeaway is the sustainable change equals to the improved engagement and outcomes. Thank you. Grateful for your time, efforts, and constant support. Your contribution has made a real difference, and I truly appreciate it. And these are the references. Thank you.